Risks of glaucoma. Researchers now view glaucoma as a disease of the brain, rather than simply an eye disease. The retina and optic nerve are both made up of brain tissue and are part of the brain. In glaucoma, changes occur in the back of the eyes. The optic nerve continues to be a focus for researching the underlying causes of glaucoma. Whether due to mechanical trauma, decreased blood flow, or other causes, optic nerve axon injury causes changes in retinal ganglion cells, eventually resulting in cell death. Following are the underlying risks of glaucoma. Neuroinflammation. Glaucoma, especially if acute, may be largely an inflammatory condition. Researchers believe that high intraocular pressure triggers an inflammatory response. In experiments, inflammation occurs in the central nervous system and at early stages of glaucoma. Inhibiting the process through which inflammation develops appears to protect the neurons from damage. Oxidative stress. Increased oxidative stress is a risk factor. Antioxidant drugs and nutrients that reduce enzymes involved in oxidation are reported to be helpful in animals with glaucoma. Although targeting IOP has been a prime therapy, researchers are increasingly looking to provide antioxidants for targeting oxidative stress. Damage to DNA in the tissue layers that regulate aqueous humor outflow is linked to oxidative damage, as well as damage to neurons and the optic nerve. Inadequate blood flow due to blood vessel dysfunction at the optic disc. Other research finds that inadequate blood flow to the optic disc contribute to progression of glaucoma. Harmful drugs. Some medications actually increase your chances of developing glaucoma, like steroids. Computer use. Heavy computer use increases glaucoma risk. Japanese researchers have found that people who are on the computer all day are at higher risk for developing glaucoma, especially if they are myopic. Thyroid. Have your thyroid checked, since some causes of glaucoma have been tied to low thyroid functioning. Genetic mutations. 2009 research found that simultaneous mutations of the WDR36 and STI1 gene are causal factors for glaucoma. Estrogen insufficiency. Some research suggests that, due to surgery to remove ovaries before menopause, subsequent estrogen deficiencies may increase the risk of developing glaucoma. Women who had the surgery, oophorectomy, before age 43, had a much higher risk of developing glaucoma, even when they were treated with estrogen. Alzheimer's disease. Researchers have found a likely link between Alzheimer's and glaucoma, with Alzheimer's patients being at greater risk of developing glaucoma. Retinal vein occlusion creates an increased risk of developing glaucoma. Smoking tobacco creates a much larger risk for the user to develop glaucoma. Homocysteine. High levels of homocysteine have also been identified as a risk factor for open-angle glaucoma. Other studies link high levels of homocysteine to the onset of pseudoexfoliation glaucoma.